Hi, I'm David Reichman. I'm an associate professor of reproductive medicine at Cornell. I spend my days seeing fertility patients in New York City and doing research in infertility. And today we'll be talking about nuances regarding AMH, or Anti-Müllerian hormone. So what is AMH and how is it related to fertility? So AMH, or Anti-Müllerian hormone, is a protein secreted by follicles in the ovary. Follicles are small fluid-filled sacs in the ovary that you can think of as the house for each individual egg. So there's one microscopic egg within each follicle, and those follicles mature over the course of a cycle, leading to ovulation. Now, what's interesting is we don't actually have a great handle scientifically on the physiologic role that AMH, or anti-Müllerian hormone, plays in the adult female body. We don't know what role it's playing inside the woman. It probably is related to the rate of the development and maturation of the follicles, but we're still researching that. What we do know is that it is an excellent quantitative marker of egg reserve. What does that mean? It tells us how many eggs are actually in the ovaries, and we call it a marker of ovarian reserve. I should say that along with AMH, we have antral follicle count, which is we can measure the number of follicles that we see on ultrasound, and that usually correlates with the AMH level. So if we see a lot of follicles on ultrasound, usually the AMH will be higher. Now, for many years, all we had was follicle stimulating hormone, or FSH, as a test to tell us what a woman's ovarian reserve was like. And that test was good to a point. If the FSH was elevated, it would tell us that the patient had low ovarian reserve. How do we think about FSH? We can think about it as a gas pedal, and we can think of the ovary as an engine. If the engine is weak, the brain, the gas pedal, has to step on the gas really hard to get the follicle to develop, and that's a sign that the ovarian reserve is weakening. But for patients who have kind of an in-between ovarian reserve, where it's a little reduced for their age, but still not terrible, the FSH would still be normal. So that was a binary result, either bad or okay, but no shades of gray within the okay. Whereas AMH, anti-Müllerian hormone, is a quantitative marker of egg reserve. A low ovarian reserve will have a lower AMH. A higher ovarian reserve will have a higher AMH. And so in this way, we can really have a scale of exactly where this woman falls for her age-related reserve according to her age. How can someone get their AMH tested? So nowadays, AMH is pretty readily available. So if someone is seeing their primary care physician or obstetrician gynecologist, you can request an AMH, anti-Müllerian hormone level. So it really helps to have a physician who understands the nuances of AMH and can help counsel you about an abnormal or a normal result and put it into the context of your age and your fertility goals. In general, the doctors who are going to be most knowledgeable about AMH are reproductive endocrinologists or fertility specialists, who are OBGYNs who have done 3 years of additional subspecialty training in reproductive endocrinology and specifically IVF and fertility. And a consultation with those physicians can oftentimes shed greater light on your AMH and what it means for your specific individual fertility goals.